Hello, everyone. My name is Shawn Howell, and I'm here today to present my quality improvement project of a CDC Clear Communication Index guided COVID-19 educational toolkit intervention to decrease vaccine hesitancy. This project is for the submission to the faculty of the Catherine McCauley School of Nursing in partial fulfillment of the requirements for the degree of Doctor of Nursing Practice for Maryville University. My committee members are my chair, Dr. Ashton Lindsay. My second reader is Dr. Rita Wunderlich, and my community member is Gwendolyn Black, APRN. The background and significance of the project. The COVID-19 pandemic's been world-changing, to say the least, and millions of deaths, severe illness, hospitalizations, and long-term health effects, and a whole new approach to the way we interact socially in the world has come about just right before our eyes. The hesitancy of individuals in the population to get vaccinated against the COVID-19 virus is well known in society, and it has been noted since the time of the arrival of the COVID-19 vaccine. In November 2020, just prior to the vaccine release, a surprising 40% of Americans plan to either, quote, definitely not or probably not accept the COVID-19 vaccine. Current health literacy lacks clarity, readability, and understandability. Clear, appropriate communication is essential to reassure individuals about COVID-19 vaccine safety, efficacy, and potential side effects. The average person in the U.S. may have difficulty reading and comprehending information on COVID-19 vaccines that are provided for the general public. And studies reveal that half of the adults in the U.S. read at a 7th grade level, and most vaccine facts sheets are too complex for most adult readers to understand. Background and significance continued. Facts about the COVID-19 vaccine. Studies show that the vaccines are effective in the prevention of disease transmission and severe disease and or death, with the efficacy to prevent COVID-19 and severe COVID-19 at 79.7%, efficacy of 66.4% in preventing symptomatic infection, and 47.6% in preventing asymptomatic infections. The CDC Clear Communication Index helps guide the development of educational materials. The index is a scoring tool for research-based criteria to develop, assess, and improve health communication material. The index evaluates materials in 7 areas: risk, numbers, behavioral recommendations, state of the science, information design, language, main message, and call to action. The development of a clear communication toolkit for the purpose of educational awareness on COVID-19 vaccines will provide clear instruction and knowledge to patients. This clear communication toolkit will promote understandability at any level and promote the guidance needed for potentially improving population health outcomes. The significance and aim of the project: to provide clear, factual, understandable education on COVID-19 vaccinations in terms that adults in the general population could comprehend, therefore decreasing COVID-19 vaccine hesitancy and promoting acceptance to vaccinate. This will promote higher vaccination rates in hopes of better overall health status in the general population, in turn progressing toward a herd immunity status. During my review and synthesis of the literature, 4 common themes were revealed, and they were COVID-19 vaccine hesitancy, COVID-19 vaccine literacy and readability, COVID-19 vaccine acceptance, and COVID-19 vaccine perceptions. And these specific themes provided the most supportive information to guide the DMP scholarly project. The objective of the literature review is to find evidence-based supporting resources to justify the need for the development of a clear communication toolkit based on promoting COVID-19 vaccinations. Some strengths of the literature: measurement tools were valid and reliable in most studies. Most of them had large sample sizes and showed support for clear communication toolkits. And there was support for promoting vaccine literacy. Some of the weaknesses found in the literature: there was a need for more than one communication strategy versus whether it be a toolkit. There were other strategies included in the study, so it wasn't just on one communication toolkit. Limited studies on the communication or the Clear Communication Index. There was some that included it, but not any that were specifically on the Clear Communication Index itself. Some gaps and limitations. There was jargon and linguistics included in some of the studies that could have affected the outcomes. Knowledge, since some of the research studies have changed, possibly affecting outcomes. And then also, some of the studies had small sample sizes, which may have limited or affected the outcomes in the literature. Theoretical framework. My project focused on promoting clear, understandable COVID-19 vaccine information to the adult population, and is most closely represented by Ashton and Fishbein's theoretical framework, the theory of reasoned action. The theory was originally developed in the 1960s and was used to help describe a person's reasoning for doing specific behaviors or actions. This theory assumes that a person's actions and behaviors are directly connected to their attitudes, intentions, and beliefs. The theory also assumes that no matter how the beliefs are acquired, they still guide the decision to perform or not perform the behavior in question. Fishbein and Adston described their theory using a schematic representation for easier interpretation in their original study. In that schematic, intention is assumed to be the biggest predictor of behavior or their action, but a person's abilities, skills, and environmental factors should also be considered as a major influence on their actions. Fishbein and Ashton believed that a person's strength of their intentional behavior was limited by how much control they must have to make a behavioral decision. An individual's lack of internal resources, such as ability and skills, may make it difficult for them to make the best decision in their actions. Methods and design of the project. The CDC Clear Communication Index was used to guide the development of the COVID-19 educational toolkit prior to the intervention phase. Quantitative data was used to evaluate if the use of the CDC Clear Communication Index guided COVID-19 vaccine educational toolkit would decrease vaccine hesitancy in the adult population as compared to no intervention. Prospective anonymous data design was used to collect de-identified data, which was then transcribed onto a data collection sheet, and only I, the researcher, retrieved and inputted data into the data collection tool to ensure the quality and accuracy of the data. The data collection instrument drafted by me, the researcher, before Institutional Review Board approval and data retrieval for the pre- and post-assessment of the educational intervention, only the minimum data necessary to accomplish the goals for the project was used on the data collection sheet. This instrument was used as a tool to reveal the effectiveness and outcome of the QI intervention. The Clear Communication Index and other pertinent research details were notably referenced in constructing the data collection sheet and the pre- and post questionnaire. Primarily, the tool served to help ascertain how I, as the researcher, would quantify accuracy. A comparative pre- and post questionnaire with two groups, a total of 154 participants, all of whom had previously met the inclusion and exclusion criteria for the project. The sample population for the research project were adults aged 18 to 89 years old who were previously scheduled at the target clinic between the dates of 9/15/23 to 12/6/23. There were 154 participants included, which included all ethnic and all gender groups. All of the participants were unvaccinated from the COVID vaccine or virus. All participants met the inclusion and exclusion criteria for the study. Data analysis and presentation of the data. Descriptive statistics are a part of quantitative data analysis that can help the comprehensive overview of the dataset sample or study population. The term descriptive statistics refers to data analysis that aids in the intelligible description, display, or summarization of data and provides a description of the data collected during quantitative research. The nominal data collected to evaluate the Clear Communication Index guided educational toolkit effectiveness was analyzed utilizing an upper tail z-test for the difference of two proportions with an effect size of 0.05. The z-test was used to determine if there was a statistically significant difference between the pre- and post-intervention COVID-19 vaccine agreeance, which is vaccine acceptance, in the sample group. The range or spread of the data in the dataset is known as the degree of variability. Greater dispersion of data is associated with higher variability and is deemed heterogeneous, whereas lower dispersion of data is associated with lower variability and is considered homogeneous. All other things being equal, a larger level of variance in the research sample translates into a higher level of dependability of the research. This project data was homogeneous in variability and concluded a confidence interval of 95% ratio. The confidence interval was based on the mean difference of the pre and post intervention questionnaire results. The z-score or standard score is the number of standard deviations a given point lies above or below the mean. With a 95% confidence level, 95% of all sample means were within a confidence interval of plus or minus 1.96 standard errors of the sample mean. Thus, the standard errors calculated for the data sets indicate that the sample was representative of all the overall population. This study utilized a longitudinal design, meaning that data was collected at more than one point over a period of time. The study consisted of 2 collection points utilizing the time frame from 9/15 to 12/6/23. Data was collected from participants who were unaccepted of the COVID-19 vaccine. The pre-intervention questionnaire was performed, followed by the intervention of providing the educational toolkit, and then subsequently they were given the post-intervention questionnaire and the data was compiled. Time was a significant factor in the study because several months were required to obtain an adequate number of patients to be seen in the clinic location to obtain the desired number of inclusive participants for the sample size. Results. An upper tail z-test for the difference of 2 proportions was used to determine the statistical significance of the difference between the pre-intervention group and the post-intervention group. There was a statistical significance between the pre-intervention and post-intervention COVID-19 vaccine questionnaire acceptance rates according to the statistical analysis of the study data. At a 95% confidence level, the p-value was less than the significance level of 0.05. The upper tail z-test for the difference of 2 proportions revealed that the CDC Clear Communication Guided COVID-19 Educational Toolkit provided to the adult participants proved effective in increasing the number of adults accepting to get the vaccination. Therefore, the results showed the educational intervention to be successful in decreasing COVID-19 vaccine hesitancy in the general adult population. Results continued. For ease of visualization and comprehension, the data was presented in this chart with results indicating a statistically significant improvement in the COVID-19 vaccine acceptance rate. As we can see here, the vaccine acceptance went from 0 to 77 in the post-intervention phase of the study. That means that half of the participants changed their mind about getting vaccinated after the intervention was implemented. Limitations of the study. Several factors could have impacted the results of the study due to limitations. A notable limitation was the use of only one clinic site for data collection. Multiple sites could have provided a far bigger research group from various regions for further evaluation of the data. Bigger sample sizes offer the chance to offset abnormal data and reduce sampling mistakes. Although all ethnicities were presented in the data gathering process, the demographic information was not used to analyze the outcomes. This project could have been used over an extended time frame with updates depending on current guidelines and recommendations. Bias is also a consideration while determining that I, as the researcher, had access to and employment at the data collecting site. However, bias was kept to a minimum by following rigorous adherence to the ethical and moral guidelines and code of conduct established under the institutional review board process. The limitations were also minimized by the compliance standards oversight of the facility and the university IRBs. Generalizability, this project characterizes that as the results or usefulness to a broader group of people in settings outside the project clinic site and in other patient populations. The generalizability of the project was limited as the patients in this study location are only adults 18 to 89 years, although further studies may represent a more detailed breakdown of specific age groups and how they respond to the intervention independently. Discussion. So how does the results of this quality improvement project relate to healthcare and the impact on society? We're all aware how much the COVID pandemic affected not only our local communities, but the world as a whole. Fear, frustration, sickness, and deaths have touched most everybody at this point since the beginning of the pandemic. As we're all aware, the hesitancy of individuals in society to get vaccinated against the COVID-19 virus is a huge problem, leading to continued severe illness. So what can we as healthcare providers do? For many individuals in society, the current state of health literacy surrounding the COVID-19 virus and vaccination is unclear, difficult to read, and difficult to understand, which creates obstacles to their understanding and decision making. Vaccine literacy encompasses an individual's motivation, knowledge, and ability to understand, access, and use health information to make appropriate and effective decisions regarding their health. The Quality Improvement Project supports increased COVID-19 vaccine acceptance after the implementation of an educational toolkit that provided factual, clear, and understandable COVID-19 vaccine data and information to the targeted population. As healthcare providers, we must do what we can to ensure our patients have the information needed to make their own informed decisions. Utilizing this Clear Communication Index guided COVID educational toolkit on a regular basis has the potential to impact population health in a significantly positive way. Decreasing vaccine hesitancy is the basis for promoting much needed life-saving vaccination acceptance in society. Doing so will have a huge impact on the health of everyone and having the potential to prevent a future COVID-19 pandemic. Implications for nursing practice. The COVID virus continues to be a major cause of severe illness and millions of deaths worldwide. The Clear Communication Index guided COVID-19 educational toolkit provided much needed factual and pertinent information that was needed to promote a decrease in vaccination hesitancy, increasing vaccine acceptance, and leading to an overall healthier population. The toolkit was developed to provide COVID-19 vaccine facts, focusing on the most important research-based items that enhance clarity and aid understanding in the targeted population. The uniformity that results from standardizing care processes helps to minimize care gaps, so it would be beneficial to utilize this method of developing educational toolkits in all genres of healthcare. This project identified gaps and missed opportunities to provide education that patients could fully comprehend at any level. Addressing this issue has shown a significantly positive outcome in COVID-19 vaccine acceptance. With this knowledge, patients were more equipped to make decisions about vaccinations, both in terms of understanding and comfort level. Continued use of this COVID-19 vaccine toolkit will progressively push population health to a herd immunity status, limiting severe illnesses and deaths. So, in conclusion, the hesitancy of individuals and the general public to get vaccinated against COVID-19 virus is a huge barrier to overcome. The COVID pandemic changed not only the U.S., but the world as we know it when it comes to healthcare crisis aftermath. Many factors come into play when we look at why people are hesitant to get the COVID-19 vaccination. This Quality Improvement Project focuses on key factors related to current healthcare literacy materials and literacy skills of adults in the general population. The CDC Clear Communication Index is a tool that can be used to guide the development of educational material focusing on clarity, readability, and comprehension to any targeted audience. Utilizing this tool, an educational COVID-19 toolkit was developed for a quality improvement intervention research project in a chosen population at a particular healthcare setting. Participants were chosen who met all inclusive and exclusive criteria. Pre- and post questionnaires were given and then analyzed after all the data was anonymously collected. The finding revealed a statistically significant improvement in the post-interventional phase with a significant increase in the rate of COVID-19 vaccine acceptance. This concluded that the Clear Communication Index COVID-19 educational toolkit was successful in decreasing vaccine hesitancy in the chosen population group. The findings have the potential for a larger impact in society by utilizing this toolkit in many different healthcare genres. Adopting the use of the Clear Communication Index guided COVID-19 vaccine educational toolkit in applicable health facilities, we can anticipate promoting a huge decrease in COVID-19 vaccine hesitancy, which in turn will lead to a healthier population with fewer incidences of COVID-related severe illness and deaths in population health. This DMP program has expanded my knowledge and helped me become a more self-assured caregiver by providing me with access to resources, evidence-based practice, research, and skill development. I want to keep developing as a leader and perhaps use those qualities outside my community to other fields where I might directly impact other small towns in my own. Overall, the DMP program has given me more access to a vast array of knowledge and research expertise that I was previously unaware of. Questions? I look forward to any questions or comments regarding my scholarly project, so please feel free to contact me for further discussion. Here are the references for my scholarly project. Here are my references continued for my scholarly project. My contact information is listed here, along with a QR code to scan for easy access to all my references for this scholarly project. Thank you all for watching, and I appreciate your time and attention.